Hi, Mike McGrath from Semantrix. What we'd like to provide here is a quick demonstration of the various elements of our HSR, Health Sense and Respond, Situational Awareness Platform variant. It's designed as an action support system for nurses, and we demonstrated this at the HIC 2012 conference, Health Informatics Conference in Sydney earlier in August. The main things that come out of HSR is what Semantrix believe medical decision support will look like in the next decade. Future hospital systems will monitor your location. They'll be integrated with NFC and RFID tag and Zigbee communication systems. Smartphones and iPads will be used for information presentation to staff in a context-aware way. Doctors will get what they need. Physios will get the summary that they need of patient activities and exercises. Nurses will get handover information and patient trends in terms of their O2, blood pressure, whatever else is relevant. Contextually aware information. So we believe high quality relevant information made available to staff next to the patient translates to more informed decisions, and that will deliver better patient outcomes. In the case of this demonstration, we also have mobile phone delivery of some certain content element. As can be seen from the slide in the pack, we have mobile phone delivery of information relevant to a particular staff member. So Nurse Eames will see her assigned patients, their current status, if anyone has a problem, i.e. Harry is missing from his room, John Doe has an ECG alert in his room, and if we want, we can drill down and find out exactly what's triggering that alert. So again, the same information which can be queried in other locations will be made available to the staff contextually aware. So your patients, their conditions will be fed to you. Any changes of conditions will be fed to you instantaneously. And if you're not in the location that allows you to actually administer that patient or are unable to respond, an appropriate response from another nurse would be generated instead. So here's a simple visualization of what's happening from our system. It's monitoring, courtesy of this panel, simulated sensor feeds, which are triggering off certain behaviours. We have a non-standard ward, and then we have neonatal, critical care, a security ward. We have elderly patients, psychiatric patients, and patients with dementia in the space. Now, starting from the top left corner, we have two babies. And as we start our simulation off, baby Jack has some issues with O2. If there's any issues with baby Jack, i.e. his oxygen level starts to drop below a certain threshold, a COI, a condition of interest, is being registered telling Nurse Smith that if his blood pressure or his O2 gets below a certain level that she should respond. She administers to baby Jack, and lo and behold, his O2 starts to pick up. The nurse is released back to her normal activities, and Jack's happy and well cared for. Now we have Prem baby Anne, who has both blood pressure and O2 issues. In this case, we've registered COIs so that if the blood pressure or the O2 starts to drop, a nurse will be dispatched. However, if we also see a drop in oxygen levels as well, so that there are both conditions occurring, then a doctor will be dispatched to help her as well. Obviously, this is slightly unusual, but we hope this gives some indication as to real-time sensor interactions. Again, the COIs are there. As we raise the blood pressure, the doctor's released back. As the baby returns to a stable state, the nurse is released back to her normal activities. Now, on the next element, we have John Doe. He's in a critical condition, suspected of having a heart attack. We have an ECG system which is monitoring him. In this case, we assume the system picks up an acute myocardial infarction. That immediately triggers a response and an alert to a doctor and a nurse to respond and help stabilise John Doe. Miraculously, they're able to stabilise him in a very short space of time, and John's released, the staff are released back to their normal activities. Moving around, we have Margaret at the bottom. Margaret is an elderly lady, unstable, should be walking with a frame, so she's actually a falls risk. We also have her in a room which is monitored by a 3D visual or vision sensor, i.e. a Prime Sense or Microsoft Connect type of sensor model. That sensor with our system is able to monitor whether Margaret's up, whether she's stable, whether she's lying on the floor, and respond accordingly. So in this case, Margaret decides that she's actually going to get out of bed she's unstable, and because she's unstable, the system picks that up that she's looking unstable, calls for a nurse immediately to come and help put her back to bed. So Margaret's put back to bed. Again, you can see the COI is firing off as the system detects certain states. Now, unfortunately, Margaret's quite determined, decides she's going to get up and walk around the room anyway, gets up, falls. Now, in this case, we have a COI which says that if Margaret is lying on the floor and given she's an unstable patient, the odds are that she's actually broken her hip. Now, in this case, she was lucky and she's able to be put back to bed, and the doctor and the nurse are released back to her activities. But this would have, in the initial state, helped us to try and prevent a fall, and in the subsequent state where she has fallen, we would have had the appropriate staff on hand straight away. Now, on the left-hand side, we also have Harry, who's a dementia patient who wanders. Now, in the system, we actually have another COI on Margaret's room, which says if an unknown patient or person enters the room, to notify nurse and security, because in a previous evening, Harry has wandered into her room. It used to be his room. He's a dementia patient. He gets quite aggravated and angry if he's actually under the impression that someone else is in his room. So we have Harry get out of bed and start to wander. Harry starts to wander. As soon as the sensor detects he's left the room, a nurse is dispatched to send him back, and that's done through our interface by monitoring Harry's exit of the room using either RFID or the vision sensor systems. Harry's put back to bed, which is great, and the nurse is released back to activities. Unfortunately, this time Harry decides he's actually going to go out. He wanders, but this time he's quite insistent that he wants to go back to what he thought was his original room, Margaret's room. In this case, the COI also is monitoring and sends a security guard who helps to put Harry back to bed. Now, in this case, 2 COIs are fired, but you'll notice only 1 response was generated. Both the nurse and security were called, but we didn't duplicate the nurse request to support Margaret as well as Harry. Now we go around, again, Harry's been put back to bed. We also have Manfred. Manfred's a psych patient. He exhibits an agitated state where he wanders, shaking his hands around the room. The 3D sensor has been trained to recognise that as an agitated state. So once it picks up an agitated state, it will send the nurse. Now, Manfred's meds have not been stabilised at this point. The nurse with security will administer the appropriate updated medication. After a short period of time, Manfred will go back to bed and the other staff will be released. Now, we hope you can see from this type of demonstration that this powerful ability to combine both real-time sensor inputs, location awareness of staff and patient locations, and also the ability to represent abstract states such as unstable or agitated or wandering, allows us to integrate with security and provides a much higher level of patient care. Again, we thank you for looking at this, and would be happy to answer any questions if you care to contact us via our website. Thanks very much.